If there are defects in ketone body formation or in the metabolism of ketone bodies, definitely there will be some clinical implications. For instance, when the synthesis of ketone body is not up to the mark, you can face the diseases like or disorders like hypoketosis, in which there is a decreased availability of acetyl CoA, and you don't have eventually as a result of this you don't have much ketone bodies, so the demands of the energies are not being fulfilled as when ketone bodies are present when it is fulfilled. It also leads to hypoglycemia because, as I have told you, that energy demands are not being fulfilled, but because there is not as much ketone bodies, then the body will move towards more and more utilization of glucose to fulfill the demands of the energy, and as a result of this you face the reduction in the availability of glucose, which leads to hypoglycemia. Likewise, it can also happen that you get excessive amount of ketone bodies in your blood, which also have some real clinical implications. For example, ketonemia or ketonuria are also two diseases. In ketonemia, when the ketone bodies are higher in the blood, their level is higher, while the ketonuria, when its level is higher in your excreted urine. So, for instance, in the diabetic people, they always face this problem of ketonemia and ketonuria. Usually, the ketone body's normal level are 3 milligram per deciliter, but with people who have ketonemia, the level in their blood can reach to 90 milligram per deciliter in diabetic patients, and the urinary excretion can be as high as 5,000 milligram in one single day. That's really high. Because ketone bodies are, two of the major ketone bodies are acidic in nature. So, of course, it will lead to acidosis. pH will be lower. And other reason of acidosis in the people who are diabetic is that through their urine they get so much urine, and this urine, because of the decrease in the because of the excessive amount of glucose which they have to get rid of. So as a result of this excessive urination process, what will happen that it will lead to dehydration, and whenever there is dehydration, there is much more and more acidosis. So this is also some of the problems diabetic patients face. Maybe you can think that why diabetic patients have so much a problem of the acidosis through the ketone bodies. Why ketone bodies formation is excessively increased in the diabetic patient? What is the relationship between diabetes and ketone body formation or utilization of the ketone bodies? This is something must not be difficult for you. I will not tell you. You have to think about it. Fine.